Hey guys, I'm Nicole Chilton. I'm another one of the diabetes educators, and I'm going to talk to you guys about smart pens and CGMs today. There was another question about the emergency drugs. I'll answer before we move on, and it says if during a power outage, what to look for to make sure the meds are still usable. And we would say if it was exposed to extreme heat, if it got way above 86 degrees in your school, then it would not be safe to use. But if that happened in the middle of the summer when it was 110 degrees, I would say it's not safe to use. But in a typical time, then it would be okay. All right, so the InPen is the first FDA cleared smart insulin pen to use. It is data-driven MDI therapy using the InPen smart insulin pen. So some of you may have seen some of your kids come in with this, and it works with an app on a smartphone. It's usually going to work. It works with an iPhone or an Android. It does have a 12-month battery life warranty with it. So, every 12 months they're going to come in with a new pen. It delivers in half-unit doses, and it is compatible with Novolog, Humalog, and Fiasp. And it is available in pharmacies for type 1 and type 2 diabetics. So you'll see it used for both your type 1s and your type 2s. What this does is it tracks an active insulin dose. It reminds them to dose, and it calculates personalized insulin doses. And it does log their doses, and it creates reports for us. And it also syncs with CGMs and blood sugar meters. So the FDA cleared the smart insulin pen, and it's an integrated app. It's super simple to use, and it improves the missed doses for our kids. It works through a Bluetooth with the app, and it pairs with the meters and the Dexcoms and also the Medtronic app. It doesn't pair with the Libre just yet, and is indicated use for all ages. And for under 7 years, it does require a caregiver supervision. All right, so this is what the app looks like. It gives the reminders. We usually recommend the reminders for the long-acting insulin and the replace the cartridge after 28 days and the bedtime reminders. We typically don't set the mealtime reminders for these kids because the alarms will going to be going off all the time, and we don't recommend checking blood sugars 2 hours after meal doses typically, so we don't set that reminder. And then these are just the things that you can set for them, or that we set for them typically. And then these are some of the other screens that you have. So it'll remind them for missed doses, the missed long-acting doses, to check the blood sugar, and then replace the cartridge. So these are the screens that you will see and that you will be working with. So on the right hand up there, when you put your blood sugar in, you'll just key it in, or if they're on a Dexcom, it'll be there. And then you put your carb entry in, and then it calculates the dose for you. And then it'll tell you how much to give. It does have a fixed dose and a meal estimation dose on there. So these are for the kids that you would see which have the half plate, whole plate dosing. It'll say, so we'll have those programmed in there. So the InPen has the insulin on board feature. So when you're doing your calculations, because of the insulin on board, most of the time you're not going to, your your calculations are not going to match. So just be aware of that. So the insulin on board is similar, or is just like for a pump. So when you have that, and if your calculations are not matching what the app's calculations are telling you, it would be because of the insulin on board feature. Just go with what amount it tells you if it does not equal. So yes, you would just go with what it tells you if it's not what you're calculating because of the insulin on board feature. It's just like it calculates with a pump. Because if you're calculating with your pump, your calculations are not gonna match what the pump is telling you because of this insulin on board feature. So you're not going to be able to have that exact amount. Is insurance covering the InPen better than a pump? So yes, we do have coverage for the InPen. Their out-of-pocket cost is $35, no matter what their insurance is. I do need to show you how to change the cartridge on this. So it's just like the Novo Echo Pen. It is a cartridge. So this is your cartridge here. It drops into the cylinder, just like this. If you have it used, if you're changing one out, you'll have to dial this, your piston back in just like you would. It's a little stiff sometimes, so you just dial it back in. You do have to hold the end in because it will dial it back out, and then you just twist it until it's flush, put it in, and twist it back on. Just like for the Novo Echo Pen. All right. Do we have any other questions? All right. If you guys think of any other questions, I'll address them at the end. All right, so next we're going to talk about CGMs. And so CGMs are a way to measure blood sugars in real time. It shows a current blood sugar reading that uses arrows to predict trends and upcoming blood sugar levels. They can be 20 to 30% difference between the CGM reading and a meter reading to still meet FDA approval. So our two most common used are Dexcom and G6, and these are the two that the FDA says that we can dose insulin with. Again, these are Dexcom and G6, or Dexcom G6 and Libre have been approved for using dosing. All right, to see the blood sugar, a student will either have a Dexcom receiver compatible with a cell phone, or it may be integrated with an insulin pump. And this is for the Dexcom G6. Whichever device the student is using must remain within 20 feet of the student to be communicated with the sensor the student is wearing. So this may be their phone, it may be the receiver, it could be a tablet, it could be an iPod Touch. It's whichever Bluetooth capable device they are using. No finger stick calibration is needed with the Dexcom G6. It is factory calibrated. And so these are the arrows you would see with the Dexcom and what they mean. So if it's flat, it means that the blood sugar is increasing or decreasing less than 1 milligram per minute. Up or down, it's increasing 30 to 60 milligrams in 30 minutes. Straight up or straight down, 60 to 90 in 30 minutes, and double up or double down, more than 90 in 30 minutes. And so these arrows are whatever these arrows are doing is what we use for treatment decisions. So the Libre 2, the parents must use a receiver to obtain the blood sugar reading. For the Libre 2, there's currently not an app on smartphones for the Libre 2. The patient uses a receiver to scan to get their blood sugar reading. And so these are some pictures for the Libre 2. So you just press the home button and then you hold it over the receiver, over the sensor, and then it gives you a reading. And from the glucose reading, you can see what that is. And then you would select in the boxes. It is a touch screen, so you just kind of select what it is, whether if they're eating, if it's fasting, or if it's after a meal, and then you just press OK. And these are the arrows for the Libre 2. Of course, up means it's rising more than 2 milligrams per minute. Slightly up, it's rising 1 to 2 milligrams per minute, and then straight across, it's changing slowly. Down 1 to 2, falling down. Falling, it's 1 to 2 milligrams per minute, and straight down, it's more than 2. So the Dexcom G6 and the Libre 2, per page 4 in the medical management plan, if the CGM reads less than 70 or greater than 300, we have to verify with a finger stick before we can do any treatment. All right, any questions? So we'll stop sharing for just a second, and you won't be able to hear while you guys come up with questions, and I'll come back on in just a few minutes after we get some questions together. So we have a question of when the Dexcom G6 reading is way off from a finger stick. What do we treat with? So blood sugar is always the most accurate. The Dexcom is reading the fluid under the skin, and so the blood sugar is always the accurate one. So you would use the blood sugar as what you're going to treat with. And again, FDA approval says it can be 20% different. So if that 50 points is still within your 20%, then you're still within range according to the FDA. I've experienced Dexcom G6 to be way off as well, but I was told not to calibrate. I was told to use Dexcom G6. If this is a parental preference, the parents want you to use the Dexcom G6. I guess that's, you can tell them that you would prefer a finger stick, but if they still want you to use the G6 reading, they want you to use the G6 reading. It could be a side issue. You could try, see if they want to change the side. But again, if it's within the 20%, then it's still within FDA approval. Another thing that we teach our parents and our patients is, does the reading match the patient's symptoms? If they come in with a reading on their Dexcom of 150, but they are sweating, pale, just not acting right at all, do a finger stick and make sure that the reading matches the patient's symptoms. Their Dexcom may say 150, but you do a finger stick and their blood sugar is 50. So you would obviously go by the blood sugar. Another thing I wanted to say about the InPen and your orders. So somebody asked, what do you dose by? So your orders are going to say dose per InPen instead of rounding to the half or rounding to the whole or rounding up or rounding down. They would say dose per InPen because the InPen, it calculates it like it calculates it. And so sometimes it just rounds it, how it rounds it, just like it does for a pump because of the insulin on board.